Well, according to the Centers for Disease Control and Prevention, 1/3 of adults in the United States are obese. That's 72 million people. So if this applies to you, you certainly are not alone. One way that some people are getting help is through surgical treatment. But how do you know if bariatric surgery is right for you? Well, joining us today is Dr. Timothy Ehrlich, the Director of Metabolic and Bariatric Surgery at Griffin Hospital in Derby. Now, he's performed more than 1,800 bariatric procedures and lectures nationally. He's joined by his patient, Rosie Navarro, who is a lap band patient for over 6 years. Welcome to the both of you. Great to have you here today.
Thanks for allowing us here.
And Rosie, we're going to talk to you about your success story, your journey through the process, but we're going to kind of start with you, Doctor. I want you to kind of set up for us. I know that there's tons of weight loss options out there, but the one term that we are hearing a little more frequently is the metabolic surgery. What exactly is that?
Absolutely. It's important to distinguish that this surgery is an aid to help people with metabolic syndrome, which is essentially a constellation of symptoms in overweight people, mainly including diabetes and hyperlipidemia. The perspective in the past, this has been a cosmetic procedure, and it's really not. So we're trying to legitimize the procedure.
Yeah, because nowadays there's so many reasons as to why people need to lose weight. We talked about diabetes earlier, right? Being one of the reasons why people, need some assistance with weight loss. So what are exactly the obesity rates here in Connecticut?
The obesity rate is about 20% in Connecticut, and what's significant about Connecticut is we're one of the healthiest states in the country, but the obesity rates have doubled in the last 15 years, so pretty impressive.
And then what are we finding with children? Because it says that 16% of children are actually obese, so is that kind of on the rise at this point?
It's absolutely on the rise, and I think it's in the media every day. And this will be the first generation of kids who aren't able to outlive their parents because of obesity and diabetes.
In terms of the programs that you offer at Griffin Hospital, I mean, what do you think kind of sets you apart from the other programs that are out there? Because there are a lot of programs that are out there.
Correct. I mean, I'm pretty excited to be working with Griffin Hospital, and my goal for many, many years is to put together a more comprehensive program. It's the first program where we'll have exercise physiologists, cooking classes for patients, and more a devotion, I feel, to the holistic care of the bariatric patient many, many years after their surgery. And hopefully we're going to do that and establish that in Shelton at the Ivy Brook Center.
All right, Doctor, we want you to set it up for us and kind of break down what lap band is versus gastric bypass. What's the biggest difference between the two?
Sure, two totally different procedures.
Okay.
The lap band is essentially just a silicone belt which goes around the top of the stomach, and there's a port, and we fill the band over time. Whereas the gastric bypass, classically just making the stomach very small and rerouting the intestines. They're totally different procedures for different people, and my job really is to counsel people to make sure they make the right decision and informed decision in 2010.
All right, let's bring you in, Rosie. I want to talk about your you kind of struggle with weight, you said earlier. Tell us how much weight you've lost, and tell us why you decided to actually have the lap band surgery.
My total weight loss was 80 pounds.
Wow.
Which is...
Congratulations.
It's a difficult thing to do with just diet and exercise for someone who has a history in the family of heart disease and diabetes. And actually, I'm very active and thought I could do it on my own, but then went to a doctor's visit, and I heard that my heart had an irregular beat, and I lost my mother and grandmother to heart disease, and I said, I need to do something medically about it, and I started to consider gastric surgery.
Okay.
So I then decided I didn't want to do anything too invasive. I was a little afraid. I think a lot of people are if you don't have all the information, and especially 6 years ago when there was less information available. So I took the band. It was something that was going to take longer, but I felt I would have a higher success rate because I would learn along the way how to live as a lap band patient.
And Dr. Ehrlich, I mean, this has got to ring true for a lot of your patients. I mean, it sounds like the lap band is not so permanent. I mean, or is it?
It is. The lap band is permanent, but that is the most common thing that people respond to and choose the band because of the reversibility.
Okay.
Which is a definite asset. But what patients need to understand, it is a permanent tool to help the patient. It doesn't come out after the patient loses weight.
What do you think are some of the bigger challenges you face as a doctor when you have patients and helping them kind of decide which one is best for them?
It's getting easier and easier, actually. And what I tell patients to do is, I think all of us know someone who, either at work or at home, who's had a band or had a gastric bypass in this day and age. And I say, just educate yourself and look at those people as role models for success or failure. And I think the patients coming through nowadays have a huge advantage by learning from people who had the surgery in the past, like Rosie. So that's the most important thing that I tell patients.
And in terms of requirements, can you talk to us about the requirements that you need for this?
Sure, absolutely. The requirements haven't changed since 1991, and I think the most important thing for people to know is, number one, you don't necessarily have to have any medical problems to have the surgery or the procedure. And a good significant number of people don't. And if they meet certain weight criteria, which essentially comes out to about 75 to 125 pounds overweight, they don't have to have any medical problems. It's something that the body mass index. That's the most important thing. And the other thing in Connecticut really is that their employer carries the benefit to allow them to have the surgery.
Wow.
Which is there's a real problem in this nation, but especially for some reason in Connecticut with access to care for the surgery.
Let's talk about how you actually track success, because this is going to be rewarding. I bet this is one of the best parts of being a doctor, hearing the success stories. But how do you actually track the success stories? No, Dr. Ehrlich, we'll have him answer.
Very difficult question, because everybody's measurement of success is different after the surgery, and my number one goal is for people to be happy, and what's going to make a 25-year-old woman happy is different than someone who's 65 years old, and so that's the ultimate goal, make them happier and healthier, which is very hard to do, but it's not necessarily related directly to pounds lost. People can lose a couple hundred pounds and never be happy. A grandparent can lose 30 pounds, run around after their grandkids, and it can be a change of life.
Exactly. How do patients actually get started, Dr. Ehrlich?
All they have to do to get started nowadays really is just call the office. We have informational seminars, but we also have one-on-one consultations to see the patient, and we start there. And then we let them know what their requirements specifically are.
And for people watching, we have that free informational seminar information on our screen. The next one is Monday the 14th at 6 p.m. at Griffin Hospital in Derby, and the list is there for everyone to see. And if you missed that, everyone, you know what to do. Log on to our website, WTNH.com, and click on Connecticut Style. We'll get you there. And for Rosie, someone's going to watch today and say, I'm kind of contemplating this particular procedure. What do you want them to know?
The one that I did in particular?
Flat band.
Well, I think that everyone's life is different. So I chose it because I'm very active, and back 6 years ago, I know this isn't the case anymore because it has the innovation of the band is it's evolved so much. But back 6 years ago, it was a lot of time off after the gastric bypass.
But
surgery.
Are you happy?
I am absolutely happy. It was the pace that worked for me. Recovery was quick, and it was a learning process that it took a few months to get there. But it helped not jump into a different lifestyle. It helped me learn about how to change my lifestyle.
Thank you so very much for being here, Rosie.
Our
Dr.
pleasure.
Ehrlich, we appreciate it. All right, everybody. Griffin Bariatrics, 1-888-657-9252. Again, if you missed it, come to our website. We'll get you the link there.